Safety and post-op results of extended depth of focus IOLs. काट कर चीला गुलाफे मोतिया बाह तमाम, देखो कैसे मजहरी ने दिल बनाया आंख में. So depth of field, Dr. Professor Moeen explained very well. And I summarize this EDOF lenses with another angle. As Professor Moeen mentioned, it's the technology of future, and the focus of the industry is to replace monofocal lenses with monofocal EDOF in due course of time. And what is being done with EDOF, they come with different terminologies, but actually it is reintroduction of spherical abrasion in a refined and controlled manner. You know, with spheric IOLs, we came to aspheric IOLs, and we finished spherical abrasion by introduction of aspheric optics and came to a point focus. But once we lose that spherical abrasion and we get the point focus, we lose the depth of perception. And if we reintroduce spherical abrasion, you will see different lenses and different companies are doing it differently. Like Lucidis produces a spherical button in the middle and dedicates rest of the optic, aspheric optic for vision. And thus, instead of a point focus, it provides a range of vision, increasing the depth of focus. So that shows that the spherical lenses have an inherent beauty. Because of that conoid of Sturm, there is a range of clear vision instead of a point focus. And interestingly, I have reviewed and used multiple EDOF lenses. This Lucidis is the only lens yet around the world which is providing EDOF from near to intermediate distance. Vivity by Alcon, EMV by Rayner, Elon by Maricontour, Evolux by Sifi, all of them provide extended depth of focus from intermediate to far distance, which practically is less useful as long as the patient is concerned. We need this range of clear vision more from near to intermediate distance. And this is the only lens by SAVIOL Switzerland with the name of Lucidis, which provides extended depth of focus from near to intermediate distance. And they do it by providing a spherical button in the center and dedicating the rest of the optic for the far vision. We have published 2 papers already, and right now in the resident paper session, another study of Lucidis is being presented, in which 92% patients were 6/6 for far and 85% patients were N6 for near with bilateral implantation. So this is the beauty of this lens. It really challenges the trifocal lenses in terms of dependency on glasses, and it's a quality product. And this is how we inject it. It comes separately. We have to load it in the cartridge, and the design is relatively atypical. So make sure the leading haptic goes into the bag, because the distance between this dual loop haptic is relatively more as compared to other lenses. And this is how you load it. in the cartridge like all other lenses. Evolux by CFI provides a dose at intermediate distance and comes preloaded, but the incompatibility in our experience we have seen is very high with the injection system. It's a hydrophobic lens and is made of a kind relatively stiff material. And there was a deep transverse arrest in one of my patients, and I had to perform C-section there on the table to reload it and implant it. So the lens is good, but difficult to implant because of its incompatibility, and the hydrostatic force quite often makes it sticky, and it goes inside the eye with open legs, with open haptic. So you need to be careful about that. Otherwise, it's a beautiful lens. The nozzle is good, goes smoothly through 2.75 millimeter incisions. But opens up, you see, it's opening up with extended haptic. So be careful and move your nozzle back. Otherwise, it can end up in a surprise. Medicontour Elon is another beauty, but as you have seen, may have seen, noticed in Professor Moeen's presentation, it has two steps in the center. So where there is a ring, there is dysphotopsia. There is no ring in Lucidis, no ring in Evolux, but it has two steps or rings in the center. So that's why the dysphotopsia is there with Elon, which is not there with Evolux and Lucidis. This is a live surgery clip from previous Lahore Ophthalmo 2024, in which we implanted Elon live and on the Saturday of last conference. It behaves very well. It resembles famous Rayner design as long as the lens is concerned. And the use of that injector is quite cumbersome. It has a kind of drum and has multiple steps. And I have seen that except Hoya and Alcon hydrophobic lenses, these Elon, Evolus, and EZY lenses, it's better to wash them with saline before making them, before injecting viscoelastic over the lens. It makes your life easy and decreases the surprise. So this is a comparison of the different lenses which we have used: Lucidis, Elon, Evolux, Vivity, Alcon, and EMV Rayner and Isopure by Fizz IOL is recently there. A beautiful lens, again providing extended depth of focus at far to intermediate distance. Only Lucidis in this table provides extended depth of focus at near to intermediate. And Evolux we have already discussed. Vivity, I have very limited experience with it, but the patient I had was not happy because of relatively waxy vision and dysphotopsia at times. And they do wavefront modification, but bottom line is reintroduction of spherical aberration in a controlled manner is the mechanism of all EDOF lenses. We are very happy with Lucidis outcomes, and over 200 IOLs I have implanted in my experience. So this is their mechanism. The dysphotopsia is almost very rare with Lucidis and common with Elon and Vivity. And it's also not there in case of Evolux. And EMV we need to evaluate it by Rayner. I have implanted two EMV lenses. They behaved well. The EDOF technology appears a safe and economical and a technology of future. It appears to minimize the risk of nighttime photopsia and glare. Studies with bigger sample size and longer follow-up are recommended. And hopefully we have studied Lucidis in detail. Two papers are already published, one in PJO and one in Saudi Journal of Ophthalmology. And another paper is coming up with the experience of 50 IOLs. And another project, we are going to plot the defocus curve of bilateral implantation. It's a prospective study. Thank you very much.